My name's Gail Zahtz. A few years ago, I refused hospice for late stage what started out as breast cancer. And I have been incorporating my patient journey with my work and personal story since.
Welcome to Tumor Talk, and thank you for letting us join on your cancer journey. Today we have a very special guest joining us to share her cancer story, all the way from New York via the internet, because we're still all locked down in COVID-19. Please welcome Gail Zahtz. Hi, Gail. Thank you for joining us.
Hi. Thanks for having me.
Really appreciate you taking the time to talk with us. How are you doing during the lockdown?
You know, it's interesting because for me, lockdown has been pretty great. I mean, I'm healthy, thank God. My family's here. I have work. I'm doing so much better than so many people.
Yeah.
And I think coming from where I came from, there's a lot of parts of this that are frightening to people that I've already gone through. So it's perhaps less frightening for me.
Right.
And also, after you go through intensive cancer, you learn to really live in the day and the moment. And in the day and the moment, my life is really good.
Right.
It's really good. So
it's really hard for, I think, anyone to kind of grasp the outlook of life that someone who's gone through cancer really has. And it's different from patient to patient, but I mean, it's so different from the way the rest of us live our lives.
For me, and I can say this for me, right, because it's my journey, cancer was the best thing that ever happened to me. It was terrible and awful, which I'll talk about, but who I am as a person coming out on the other side is so different and so much better, and how much I enjoy life and the people around me and the appreciation I have is just something that I never had before.
Right.
And it completely, people keep saying, well, we just had a house fire in the middle of COVID. And people say, how are you so calm about all this? I say, really? Just doesn't matter. Everybody's healthy. It's fine. We're good. Because that's because of everything that I went through, which was not a pandemic. It was my own personal journey, but that was enough. That was as bad as it could get for me.
Right. So for those who don't know your story, let's start kind of at the beginning. You were midlife in your 40s, so that not a juvenile cancer, but not really a cancer of the elderly that we normally associate with a lot of cancers.
Right.
So, you're a healthy adult, really, in midlife. Tell me how did that start? How did you start knowing something was wrong?
So what's interesting is that you'll hear about how my diagnosis was missed. What should have been a pretty simple situation became really complicated because it was missed. And one of the reasons it was missed was that I was sick. And we're not really sure the chicken and the egg, which came first. Was the cancer spreading and therefore my body started shutting down? Was there something else that the cancer reset through the cancer and the therapy that then got better on its own? And it's really hard to say. By the time I was diagnosed, I had lost my ability to walk, and I was in an electric wheelchair. I was pretty much homebound for almost a year with no diagnosis. And then by the time I was diagnosed, I was very, very sick. I had requested a mammogram a few years before,
Mm-hmm.
and I was turned down because I was too young.
Oh, wow.
So you're right. So this is during the time when they keep changing the numbers. Like if you're 40, you get a mammogram. No, if you're 45. This was when it was 45 and I was younger than 45.
Right.
And I said, well, what about a mammogram? And the doctor said, no, you don't qualify for a mammogram. So needless to say, I switched primary care doctors because after we got the mammogram and the biopsy, it had started as a ductal carcinoma, but it was aggressively metastasized into the lymph node system, which can jump to the brain and jump to a lot of organ shutdown. I had so many organs that had shut down by the time it was diagnosed. So, but I don't talk a lot about getting mammograms and pushing for them, but I think starting with this conversation, I will. Really, right? If I had pushed for the mammogram, who knows? That the reason I got the mammogram was I did a self-exam. Like in the midst of me being really sick, and it sort of dawned on me, I said, what have I not done? I said, I'll do a self-exam, like just a random. I said, this doesn't seem right. So I saw a doctor and I said, can you feel this? And they're like, oh, we should get you seen like right away that day from can you see this? I had a mammogram, an ultrasound, multiple biopsies. They couldn't even get the bleeding to stop with my biopsy. 20 minutes, the fellow was there trying to get the bleeding to stop. Otherwise, I would have ended up in the ER one more minute longer. And then they sent me back. I got a call from a scheduler that said, we're here to schedule you with the first available oncologist. I said, oncologist, does that mean I have cancer? She said, oh, no one told you?
Oh my God.
So very different than some people sitting in an office, you know, it was, and I mean, I could go on about like having better communications between departments, right? So then I got in with the oncologist. I was offered a clinical trial. I turned it down. And within days, I was in my first round of treatment. For me, I guess part of it was a little relief because I was so sick. I was sent to a nursing home Labor Day weekend of that year after I turned down hospice. So I was in the hospital. I thought that they would not send me to the hospital because it was Labor Day weekend. Mm-hmm. That was my thought. And they sent me to the hospital and they said I was not safe at home. And 5 days I was there. The beauty of being a healthcare provider, I knew they couldn't force me to go to hospice. They brought in security. They brought in a psychiatrist for me to accept my situation. And I just like made life miserable and stayed. And so they sent me to a skilled nursing facility where I was, of course, the youngest person there. And there is where I did the self-exam. And there is where then I started oncology. So for me, there was a relief that it was something tangible.
Right.
We knew what was wrong. There was a plan. And it's really interesting. My team still talks about our first meeting because one of the things that the University of Minnesota does so well is team oncology care. So in oncology, you get the oncologist, a nurse care coordinator, and a social worker. But then because I was so sick, I got a palliative team. And that was a social worker, a doctor for medication and symptom management, and a nurse. And I met with all 6 people that first day. And I said, here's the deal. I am not going to die. So if you're on board with the fact that I'm going to live, then I will do whatever you say. I will not Google it. I will not ask all my colleagues for a second opinion. I will not question it. I am on board for whatever the treatment is, as long as you're on board with the fact that we're doing this because I'm going to live. And now they didn't really believe I was going to live. So, but they humored me.
Yeah.
And I said I wanted every possible treatment, which was a good thing because I ended up 10 months. I mean, my first rounds of treatment were 10 months of weekly chemotherapy, 5 different chemotherapies.
Wow.
So, and I got a lot of chemo.
That's a lot of chemo.
Right. And that's before other treatments. So I know there's a lot of debate among patients about this idea of being a warrior. And if you're at war, for me, that really worked.
Right.
I suited up, you know, like put on my superhero suit. Yeah. And I felt like the enemy was the cancer. And that the battle was me going through whatever it was, whether it was the chemotherapy, the radiation, the many surgeries that failed, the hospitalizations, that I went in with this idea of being suited up. And that really, for me, that really helped a lot. So, right.
So you did the full gamut. You went all the chemo. How many different chemos were you on by the end of the day? After 10 months, what were
5. I was on 5, and I did the lethal limit on AC. I got as many rounds as I could get of that before, you die of mustard gas poisoning.
Yeah.
And that was and I actually had chemo after that, right after, even after I was NED. But it was brutal. I mean, chemo is not chemo. Like, it is not all one and the same thing.
No.
I mean, yes, right, you're putting something in your veins, but it could be many things. And by my fourth and fifth types of chemo, I was on the floor screaming in pain. And the nurse came in. I later learned that something like the majority of patients don't even get through a full round of AC after which, and I'm on the floor screaming from just the pain inside. And the nurse said, should we stop the treatment? And I said, no, I promised my son I wouldn't turn away any treatment. But it is not for the faint of heart.
No.
I mean, it is. And that was, for me, chemo was only part of my journey. I mean, I had radiation, I had surgeries, I lost part of my vascular system. I mean, I was blind. I was legally blind. I was in an electric wheelchair. I could not eat for 2 years. I was straight boost only. I had no immune system. After the 10 months of chemo, an amazing surgeon agreed to operate. I'm sure you know, and some of your audience may know, that tumors are only operable if they're within a certain size.
Yeah.
So mine, when we started that journey, were way too big. They were inoperable. And the entire purpose of the chemotherapy was to stop the metastasization and to try to shrink the size of the tumors. So by the time I saw this amazing surgeon, it was really right on the line. He could have said it was too big. And the thing is that one of the large tumors was in my lymph node under my left arm. So he said, if I do this surgery, you may wake up without an arm because the circulation affects the arm, and he could not guarantee he could save my circulation to my left arm.
Yeah.
He says, I mean, you're not left-handed. And he looked, I said, yeah. He goes, of course you are. And when I woke up from that surgery, the very first thing I did was look for my hands. And I was like, yay, my hand's still there. So in taking the tumors, this is interesting. I've never talked about this before, and I talk pretty openly about the cancer. I did have a radical double mastectomy, along with lumpectomy, and that only got us so far. That got us part of the way. And then after I started radiation. Now, the average cancer patient, my understanding is that radiation is under a minute, and it goes for like 4 or 6 weeks. I had 15 minutes straight of radiation for 3 months straight. So a quarter of my body was radiated. I was in a neck support and a frame because it was all by my brain.
Yeah.
And and people are like, oh, radiation's not so bad. You know, everybody has an individual. My body was beaten down by that point. I was at this for a year before we even started the radiation. So I had the radiation and something else. And then because of all of the radiation and the chemo and the surgeries and everything, my vascular was pretty messed up in my upper left quadrant. And we ended up doing what's called a transflap, which is taking vascular and fat tissue out of my stomach. It's sort of an old surgery, and putting it up in my chest area, connecting the blood. Again, I'm sorry, I'm not giving the technical terms of this.
No, non-technical is good. People won't know what all the jargon is anyway.
Right? It's funny because in work, I talk jargon all the time, but this is, right, my story. And it was an 11-hour surgery. They could not complete all of the cosmetic work because it was 11 hours and it was not going swimmingly. They did, though, get the blood circulation going, and they got some exterior cosmetic work done. But the important part was that we had the blood flow to my arm going, and blood flow throughout. Well, and this is really interesting because this was a huge part of my journey, but not part of anything. That's usually people look at NED, no evidence of disease. And after the mastectomy and lymphectomy, officially I had NED. I had no evidence of disease. And I was able to get out of the nursing home and get home with my kids. And I have this surgery, and I had 4 C-sections, so it's not like I wasn't fine recuperating from abdominal surgery, but this just didn't close. And it opened more, and I ended up with a 40-centimeter wide wound by 8 centimeters high. Undermining is where you can put your hand in to see how far you can go, and we could go up to the elbow.
Wow.
Right? It was insane. 6 months. And it was a long time before we could even get a wound back on. And of course, during all of that, I'm open. I have no immune system. My body's been fighting this a long, long time now. I got MRSA. I got C. diff. I was in and out of the hospital for infections. And 6 months, we tried to manage this at home, and I have no spouse or caregiver. So this was like my 10-year-old trying to help out and doing my IV flushes. And plus I was back on chemo, and in fact, we would come from the hospital, and I'd say, I was burned, poisoned, and like cut today, right? Because I had like the wound debrided, which is where they surgically clean it.
Yeah.
And I had chemo that day, and I had radiation that day. And I mean, I'm doing it all with my youngest, with a 10-year-old. And she's like flushing my IVs because the home nurses are saying that that's what we have to do so I can stay home.
Sounds like she's a trooper too, just like her mom.
She is. She wants to be a doctor.
Oh, so. There you go.
Yeah, she wants to be a wound care oncologist in pediatrics.
Oh.
That's no small thing.
No, it's not.
So the thing is that what's interesting is that was a really brutal part of my journey. I was NED, but that was brutal, so everybody's journey is really different. But during the course of that, my vision started coming back at some point, like over that year. My vision started coming back. I started walking. The walking was huge. Mother's Day, actually, a week and a half is when it's my cancer-free anniversary. It was Mother's Day when I was NED 3 years ago. And 2 years ago, I did the Susan B. Komen walk with a wound back on one arm and an IV pole on the other arm. And I walked the 5K. And then last year, I did the 5K walk unassisted. And my plan had been to run this year. So it's really quick. I mean, now that I say it, like my life is just remarkably better. I mean, I drive, I walk 3-5 miles, I exercise,
Yeah, how about your arm? You talk about your arm. You talk about eye-hand coordination. You talk about vision. You had vision symptoms. You had surgery on your arm.
Yeah, and I use my arm now.
And now you can catch a ball.
I do, actually. So this was 6 months to do this.
Yeah.
6 months of occupational therapy just to do that. I couldn't do it.
It's a long road. It's a long road.
So, walking, it took me over an hour to take my first step. Like, I remember just standing there going, you're going to do it. You're going to do it. Just take a step. And I was in pain all the time. I was on the maximum dose of fentanyl, along with oxycodone and OxyContin and benzos, and I mean, an inordinate amount of medication. Mm-hmm. I don't take anything today, but I do feel also with choice that I think it's super unfortunate that patients are not given the same trust and choice, even a couple years later, that they were. I don't think, even though it was just a couple years ago, I don't think that they would have given me the medications that I needed, and I really needed it. And I don't take anything now. Yeah. So it's not like it created a drug addict or anything like that.
You had healthcare experience before your diagnosis. So you had a different perspective than maybe a lot of other patients might have in their journey. What was one of the things that surprised you the most about navigating the healthcare system, even though you kind of understood how it worked?
That's a good question, right? I talk a lot about comparisons, but surprised me. To a lot of professionals and providers, when you become a dependent patient, you're no longer the same person. That's the reality. Actually, like people didn't look at me the same way. They didn't treat me the same way. I had been used to making decisions that were millions and millions of dollars and affected many, many people. And as a patient without a caregiver, I found that the hardest fight that I had was trying to hold on to my personal, my ability to make my own decisions and have it respected.
Right.
I had such a good team that, and I've since realized that's not always the case. Having a nurse care coordinator, I can't speak highly enough of. And I've since learned that that is not everybody's oncology path. But that person, her name was Kathy Hodges, she was always a phone call away from me getting advocacy and help. The going through without a caregiver is not insignificant. It's very significant. For a long time, I called it the empty chair, because if you go into any doctor's office, there is two chairs.
Yeah.
There is right next to the doctor, there's a chair for the patient, and then there's a chair for the caregiver. And when I was getting all of this news, the cancer's not getting better, you now have an infection, you have to go back into the hospital, the treatment didn't work, whatever it was, I would kind of glance at that chair and realize there was just no one there. But the other is, like nurses say all the time, the best thing you can do when somebody's inpatient is have a caregiver stay there, have someone there, because it gets lost. And if you're not able to communicate well, in a lot of pain, just really sick, it becomes really hard to advocate for yourself. And not having someone to advocate can be a real liability. So that was, I ended up having a lot of professionals who helped with that. The University of Minnesota had even a grant that paid clergy people to just sit in chemotherapy. And it was amazing, because otherwise I would have gone through every chemo treatment alone, like completely alone. And right, so at least that way I had someone there. To me, I believe that it's really important to have purpose and meaning, no matter how intense your journey is. In fact, the more intense it is, I think the more helpful it is.
Yeah.
And I had my children, which was really helpful to me. They were still young enough that I knew they needed me. And they were kids of a single mom, and I knew there was no replacing me. That helped a lot. But my work as a healthcare person helped me tremendously. So I've been speaking for years about universal design and accessibility and safety in bathrooms and fall prevention and all of these, even though I'm known for my tech work, sort of these non-technical, evidence-based solutions for patients. And I got to a point, I had so many surgeries, so many, that the doctors offered me to have outpatient procedures without anesthesia, and I took them up on it.
Oh, wow.
It was just easier for me than the anesthesia. So when I would get cut, it was good for me to do this kind of like mindfulness, like separate out from the fact that I was being cut with a scalpel without any drugs.
Yeah.
And so I would start talking about fall prevention and patient communication and how like the room should be set up for like better efficacy for the patient. And like, I would just start talking. So third time into one of these, and I look around and I'm having a minor in-room procedure. I lost a lot of my ports. I had a lot of failure with my ports and my PICC lines. My veins were just a disaster. And so they would have to cut in and like change how they were going to get access. And so I look around my bed and there's 15 doctors there. And I'm like, guys, this is not that interesting of a procedure. Like, I have interesting procedures. They're like, right, but we hear you give talks. I said, oh, okay. Like, do you take requests? I said, well, Johnny, like, could you do fall prevention? I'm like, sure, I can. So there's 15 fellows and residents and attendings there while the doctor's like cutting me. He finishes, and I'm still talking.
There you go.
So it was really, it's like all for like finding what works in a really like positive way. And I'm as passionate about good healthcare now as I was before, if not more so. And it's sort of like was something that tied me through. That I was not just going through this as a patient for myself, but looking at the patient experience in a different way.
Right.
And that was really positive for me. Yeah, look, here's the thing. So the cancer is taking over your body. I mean, it is. I mean, that's what cancer does.
Yes.
It is this foreign being that is hijacking your ability to do many, many things. In my case, most things, right? And so the question is, where can you get kind of control? Where can you get some like claim your life back, claim yourself, the dignity? I had no dignity, right? I needed help with the most basic human function, the most basic. I mean, I was using adult diapers. I mean, I had no dignity. So me connecting with who I was as a health professional and look, that just gave me so much strength and so much purpose and really helped me tremendously. I mean, Viktor Frankl wrote a book years ago on having mission and purpose and getting through really hard times. His was through the Holocaust. And I think it was really helpful. I mean, and in terms of, so for me, there was definitely a day when I knew I was dying that day. I mean, I don't want to get into kind of a weird metaphysical whatever, but I was sure. And on the flip side of that, there was no pain. And I got to tell you, I was in a lot of physical pain.
Yeah.
Like a gut-wrenching, like unbelievable amount of pain. And for many reasons, I said, not today. I'm just gonna duke this out another day. That's not to say that people who passed away is because they chose it. I'm not really gonna, although I will tell you, being in a nursing home, which is a whole other, and now I work for nursing homes, so that's a whole conversation. There were definitely people would be like, all right, Gail, like, this is like, I'm not gonna be here. I'd be like, what? And that week they would die. Like, there is definitely a lot to be said for your personal involvement. And I think that part of the thing is, right, as the cancer takes over, looking at where I could make personal choices that helped me reclaim my journey was really powerful. For me, it was like working on anger, working on other toxic things. For me, it just, and this could be one of the reasons why it helped reset my whole life, because for me, it was very much like being at war. And I totally respect that that's not but for me it was. And for me, it was kind of like all of the armament or whatever that helped me get through that, then helped me lead a better, positive, volitional life post-cancer.
That's amazing. And you've done such amazing work since that. And I'll put some links below this in the show notes for people to follow your work and some of your advocacy that you've been doing, helping patients. So I'm really, really glad you're able to find that path forward and you didn't give up. I think we're all grateful for that.
Okay. Thanks.
I think we'll have to wrap up for time, so this video doesn't get too long, but I really, really want to thank you again for taking the time to share your journey with us.
Yeah.
So thank you so much for joining us.
Thanks for having me.
And please do stay safe in New York during COVID-19. Please do.
Thank you.
You can follow more of Gail's journey at her Twitter page at Gail Zahtz. If you found hearing Gail's journey helpful, please like and subscribe to our channel. It'll help other people find this video too. I'm not going to say much at the end of this video. I think Gail's story speaks for itself. I will throw a whole bunch of links down in the show notes, so please check them out. We are running a cancer fundraiser for the Cancer Research Institute to raise $10,000. All links down there how you can get involved. And if you like our content, please do join us on our Facebook page, facebook.com/Tumor Talk. We post lots of other cancer articles and videos and stuff like that. With that, thank you for joining us for another Tumor Talk. Until next time, no matter where you are in your cancer journey, remember, you're not alone. We're in this together.